Welcome back to today's episode of Mobility Monday. I'm Jeff Blanchard, physical therapist at Therapeutic Associates. And today we're going to be talking a little bit about back to hip pain, but now we're going to be talking about the side area of the hip. What's behind this, what's involved, and what are a couple things that you can do in order to help this get better. All right, so I have my friend here, the pelvis, back with me to demonstrate a little bit about this. As we talked a little bit about this before, on the side of the hip. So usually side of the hip pain is not so much the hip joint is having a problem. Usually it's structures that are out here on the side area. So we have muscles out here that come down and attach to this kind of bony knob piece of the femur that comes down into the knee. So namely we have gluteus medius, gluteus minimus, and a number of those other deeper muscles that we talked about before that fan across, that all bind and connect these different bones together to give you more of that stability. So this pain is oftentimes brought on by, say, walking, because every time you take a step, when you step on, when you're on one leg, you want to make sure that your pelvis is not falling down like this. If your pelvis kept falling down on one side, it would look kind of like this and kind of like this, and that would create a lot of problems. And you'd lose a lot of your power and your endurance and your ability to walk if that was happening. So these muscles have to be strong in order to keep you here and to keep your pelvis on level instead of your pelvis dipping down. So what happens is oftentimes these muscles get weak. They tend to get weak as we get older, and they tend to get weaker especially in women versus men. Now there's various reasons for that. One is that with women the pelvis is wider than men's pelvises in general. So with a wider pelvis, the angle that this bone creates is more this way. So the knees are together and the femur has more of an angle coming to the inside. What that does, unfortunately, is puts more stretch through this tissue repetitively year after year after year, which over time can create wear and breakdown in the muscle and the tissue that attaches. So that's one of the issues, is just the pelvis width and the angle of the femur as it comes to the inside. Another problem is crossing your legs. Now, I'm crossing my legs here, and in doing so, basically I'm taking my femurs and I'm crossing them like this. In essence, what that does is it takes this muscle tissue and it pulls it way out and it stretches it and it holds it in a stretched position for an extended period of time. A lot of people like to cross their legs. It helps them feel a little bit more stable. And more often, women tend to cross their legs in this fashion versus the guys, which is again another reason why the women have more hip pain as they get a little older, is because of all the leg crossing. Crossing your legs for a little bits of time is probably okay, but if you're doing much of it, you're putting a lot of stress on that tissue, especially as you're getting older. I would suggest that you stop crossing your legs. Leave some space between your knees. Don't continue to stretch that tissue out on the side of the hip, and so it doesn't take the hit of continuing to get that trauma. We also talked about sitting and not having the knees coming together. Just that action right there, again, puts some stress through that tissue as those femurs are crossing. And the one other thing that I would bring up is how you sleep. Now, if you're a side sleeper and your knees are together and you have a wider pelvis, again, you have the leg coming down in this direction. More stress is occurring on the side. So what you might do is take your pillow and place it between your knees in order to keep a gap between your knees. That's going to take pressure off of that muscle in the hip and help that be able to feel better and hopefully calm down. Now, these are some of the strategies I share with my patients when they come in and see me for lateral hip pain. I tell them, stop crossing your legs. Make sure when you sleep, and if you're on your side, make sure you have a pillow between your knees. Make sure you have a gap between those knees as you're doing your day-to-day things, and that you're not getting into this position so it doesn't continue to get traumatized. So I'll share with you a couple of exercises that you can do in order to strengthen this area and in order to hopefully help this heal if it's starting to give you troubles. All right, so the first exercise I'll show you is a clamshell exercise. A clamshell typically is a very gentle exercise, but if you have some pain in the side of the hip, you're going to want to use a pillow for between the knees because you don't want the knees to come all the way together. So I can lie down on my side, I can take this pillow, I can maybe fold it over if I want to, and then from this position, what I'm going to do is I'm going to use the hip muscle, and then I'm just going to lift my hip up. And I don't want to go very far. If you go very far, the tendency is to roll the top of the leg back. You don't want to roll your pelvis back. You want to keep your pelvis vertical here. So that's as far as my leg can go until I start cheating and dropping my hip back. So just lift, hold that for a 5 count, and then bring it back down again. So there's your clamshell. Lifting it up, holding for a 5 count, and bringing it down. If you want to make this a little bit more challenging, if this feels okay, hold it longer. Go for 10 seconds, go for 15 seconds. Hold it longer, really feel that muscle working as you're holding that position, and then bring it back down. Give it a break, and then go back and do the same thing. And then the next more advanced thing you can do is you can take a rubber band or a TheraBand, tie it into a loop, put that around your knees. Now you're fighting that TheraBand as you lift that leg up and then bringing it back down again. So that's one exercise of something that you can do to work on strengthening the side of the hip. Another one then is to straighten those legs all the way out. Roll your body forward in this position. You want to make sure you're not rolled back. Everybody wants to do it back here because it's easier, but roll your body forward, and then I'm going to have you lift your leg just about 6 inches, and then you're going to bring it back down again. Make sure that pillow's between the knees. Lift about 6 inches, and again, hold this for 5 seconds, maybe 10 seconds. The main thing I see people do wrong with this is they lift their leg too high, and then they drop their hip back in order to lift their hip really high in the air like this, and then they go too fast. Okay, so fast typically is not good when you're working on some of these exercises. It's about slow and methodical, which you might think is boring, but it's going to be a lot better for you. So take it slow, lift, hold, feel the muscle working, and then bring it back down. It's super important that you don't do an exercise into pain. We've talked about this before. If it is painful, do not do this exercise. Okay, one more exercise that you can do in standing. This is a little bit more challenging because balance is involved. You don't want to do this if this muscle is giving you much pain. So as you're getting better, or if it's not too bad, you can try this exercise. And this is just a single leg balance exercise. So basically you're just going to shift your weight to one side, use your core, lift one leg up, and stabilize, and you want your pelvis to be nice and level as you're holding this position. So you might hold this position for, again, 5 seconds, 10 seconds, and then switch, and then maybe try going to the other side, lift this leg up, keep your pelvis level. You'll probably want to do this in front of a mirror because what you don't want to see is you don't want to see this or this. Oftentimes people will compensate by leaning way over the leg because it makes this exercise so much easier. So we call this cheating, leaning towards the leg you're standing on. So trunk straight, place your weight on one side, lift your leg up, keep it centered, keep your trunk centered, strong core. That hip is really having to work as you're standing on one side. And then again, switch to the other side and try to keep yourself centered, lift the other side, keep your body centered, try not to be leaning one way or leaning the other way. All right, so thanks for joining me today for Mobility Monday. If you know anybody who's having hip pain on the side of their hip, send them our way, have them take a look at what we talked about today, or suggest that they give us a call and come in and see us. And subscribe to our channel, take a look at some of the other things that we're talking about. And next week we'll talk a little bit more about a different location of hip pain. And so remember, until next time, motion is lotion.